computer. Okay, so this is, I believe, the 5th one I've done of these. And
Yeah,
so,
I read that.
yeah, it's pretty exciting. Actually, another Tammy requested this, so I don't know. I had to reschedule it, so I'm not sure if this day worked for her, but I'm going to record it regardless so she can watch it later. But so today I am talking about posterior tib tendon dysfunction. My Siri keeps thinking I'm talking to it today, and I'm just not talking to it. Okay, play from the start. And so I'm going to go into just kind of like overall anatomy of the ankle first, just to give you background information, kind of high level, and then get to that specific muscle and how it gets irritated. So the ankle in general has 2 main compartments. So there's the medial and the lateral compartment. So the irritated part we're talking about is on the medial side, but I just wanted to give you some reference. So the lateral compartment is like when people roll their ankles, when they sprain their ankles playing sports, like 99% of the time, it's this lateral compartment. So there's 3 ligaments out there called the lateral collateral ligaments. And so if you land with your foot and it rolls like in, that's what you're spraining, these outside ligaments. And so there's also lots of muscles. So in this top picture here, these are the ligaments that you mainly sprain. And then down here, different colors are the different muscles. And so a lot of times, just kind of a random fun fact is that after people have like repetitively rolled their ankle so many times, these muscles out here, the fibularis longus and brevis, end up having to work much harder because they have to make up for the lack of stability from the ligaments. And so then I see a lot of times people that end up with pain there. So the medial compartment, so the inside of the ankle. So these are the ligaments in this top picture here. So there's 4 of them, and they're called the deltoid ligament together. And then the inside, the medial part of the foot creates, I have my little model here, that's where the arch of the foot is. So if you think about, if you have flat feet or not, the arch is this inside medial compartment part. And so it's supported by muscles and ligaments to create stability and mobility. And so these pictures or these colors here are the muscles that are on the inside part. And so specifically the one in red is the one we're going to be focusing on today. So it comes and it attaches to this navicular bone here. And we will talk about why it's so important. So it plantar flexes the ankle. So it points the foot and it moves the foot in. Not much structure on this guy.
I don't even know what I'm looking at right there.
This is a foot.
No, I mean, I'm talking about on the screen. Is that a calf?
Oh, sorry. Yes. Okay, so this is the muscle in red here. So this is the back of a leg. So this is the calf. This is the calf area with the calf muscle taken back. Gotcha. So these are deep muscles. So this is attached to the tibia. So it's at the very back underneath the calf muscles is this muscle here. So a lot of times there's a lot of tightness in this muscle and you can kind of feel like a tight band if you go over your calf muscle. But so this is the posterior tib muscle belly. And so it runs down through here, and then this is kind of another shot of it, comes around the inside of the ankle joint. And I have more close-up pictures of this on the next slide too, but around the inside ankle joint, and it comes under and it attaches to the foot. So it crosses the ankle. And so the motions, and this is it's kind of a big statement, but this is the muscle that works the hardest while you're walking for the foot. And it's not that big, as you can see. So it points the foot and also moves the foot inwards. And so because of the fact that it goes around the ankle and comes under and it supports that inside arch, it's essentially constantly on during the entire time you're walking. So there's different phases and most muscles turn on and off, but this muscle specifically stays on the entire time. So at the very beginning, as it lands and comes down, it's controlling the arch from collapsing. And then as you keep walking, it tightens the arch as your foot moves forward. So that's kind of what all these words say here. But the biggest, most important part is that it never gets a chance to turn off, and it's working different types of contractions throughout the entire cycle of walking. So I don't know, well, I guess I should go into all I was going to say. So the posterior tib tendon gets irritated in people often. I'm going to go into how it gets irritated in the next couple of slides, but these are just kind of an overview of the different stages that you can go through. So really, if this muscle starts to get irritated, it's important to seek treatment to begin with, because the farther it gets along, the less likely you can really do something conservative to treat it. So when it's in this first stage, it's like the tendon is still intact, and you're going to have some pain on this like inside area of your foot, maybe some swelling, but it probably doesn't hurt when you walk yet. And there's probably like, maybe if you ran, it would hurt. So stage 2 is it continues to get dysfunctional, but you're going to start to, this is like the most common cause of acquired flat foot in middle-aged women specifically. So the arches that people maybe once have start to collapse because this muscle can't hold up its part of the deal anymore, essentially. And so these people are acquiring a flat foot that maybe they didn't have before. And so it's like normally painful for them to do a heel raise. So this is kind of a picture of what it might look like during that phase. So this heel kind of starts to turn out, the foot starts to turn out, and this arch starts to come down here.
So that's like different than being born flat-footed per se?
Yes.
Because that doesn't, yeah. Okay.
Yeah, it is. And it normally happens like middle-aged people. But yes, it's different than that. Like some people truly are born with more of a flat foot. Being born with a flat foot does put you at more of risk for this, but typically these people are not born with a flat foot. It's just the tendon or the muscle is getting dysfunctional over time, and it ends up leading to the muscles not supporting that arch anymore and gravity kind of just pulling it down. So, and you're on your feet all the time. So it's a really hard thing once it starts to kind of get out of too. So stage 3 is it keeps getting worse, more degenerative changes. So you're ending up with arthritis during this time. And then it gets really bad. The heel is like totally rotated out. So I think I have pictures for sure. So we'll go to the next one. There are pictures. So some of the risk factors for this. So middle-aged women, sometimes it's like a traumatic for young athletes, definitely happens. High blood pressure, so obesity, having more weight on your feet, diabetes, so anatomic variances. So some people are born with like an extra navicular bone. So anything like extra bones in this area definitely can affect it. People that are like double jointed or just have more ligament laxity in general are more prone to this because the ligaments aren't supporting it as much. So more stress on the muscles. Previously existing flat feet, like we talked about, someone that was born with more of the flat foot, being like taking steroids frequently throughout their life, that affects kind of all the muscles and ligaments. Overuse, so just overuse. If there was any kind of ankle fracture before or rheumatoid arthritis. Okay, so now we're going to go into why does this happen? So, I mean, those are the risk factors, but just because you have those things, it doesn't mean this is going to get irritated. So the way this tendon runs, so here we're looking at, this is the ankle joint. I don't think most people realize how many bones are in the foot and ankle, but it's not just like one hinge joint. Like, so this is like 1, 2, 3 just in the heel. Well, 4 actually, 4 bones even just in the heel. And then there's just a ton of them. So in this picture, this red is the muscle belly. And so the tendon runs here. This is going right under your middle ankle bone. And it comes down and attaches to this navicular bone here. So part of the reason why this is prone to injury is because the blood supply in this part of the tendon is really not good. So in order for something to heal, it has to have a blood supply. So, you know, like if you've maybe heard about someone who gets a stress fracture in their foot and it's really hard for it to heal because it doesn't have a good blood supply. You need blood for things to heal. So specifically at this part, because it's in a very deep layer, like as you saw behind the calf muscles, it's really hard for it to heal itself. So that's why this is challenging. And so it works, you know, like I said earlier, it works through all the phases of gait. So it's working extra hard. And then the repetitive loading causes micro trauma. And then because of the lack of blood supply, it's harder for it to heal. And then another reason is just kind of, if I go back to the shoe lecture I did before, the shoe journal club, because of the way shoes are, the foot intrinsic, the little muscles in the foot oftentimes aren't working as well as they need to because of not having to really in our modern shoes. And so that muscle doesn't get the backup from those little muscles in the foot. So more stress on this tendon. So I'm not going to go into all the specifics here, but this is from the research. And essentially it was looking at somebody that has dysfunction in this tendon versus not, and where the stress goes on the joints. And the moral of the story is some of the joints are taking less stress that are designed to take more stress. And some of the joints that are supposed to take less stress get more. So essentially the pressure is changing from the joints that are supposed to get the stress to other ones because this muscle isn't working like it's supposed to.
So these are all parts of the ankle though? These are different where bones meet?
Yes. So I don't want to get too technical. I was just trying to kind of show that it's legitimate. So the subtalar joint, so this first one here is this joint. The calcaneal cuboid, over here, is this joint here on the outside. The ankle joint is the talocrural joint, is this one. So yeah, and the talonavicular is this joint. So yes, these are all joints in the ankle. So it's looking at when this tendon isn't working right, how does the stress move between the joints? And it really, it takes away stress from the actual ankle and this one because the muscles aren't working so well. And it puts it more on this one.
Got it.
And then this same idea. So now this is talking about more the joints in this part of the foot. It's just working its way down. So same idea, it's taking the stress off of areas that were designed to take more stress and putting it on areas that weren't designed. So really causing like a cascade of effects if this muscle isn't able to function the way it's supposed to. Okay, so now for treatment options. So it depends on the phase you're in, what you can actually do to help this. So catching it in this phase 1, phase 2 is really important. So if you start to get that medial ankle pain, which honestly is not, people that like repetitively sprain their ankles, like I talked about before, get pain on the outside of their ankle. So pain on the inside is definitely different. And so if you start to feel that, it wants to be a trigger that I should be doing something and not just ignoring it, because it can become chronic very easily. So conservative management with like NSAIDs and activity modifications. So taking the stress off your feet when you can. So there's, I'm going to go anti-inflammatory, sorry, non-steroidal like an Advil. And so I'm going to go more into these exercises in a couple slides. This is just kind of the overview, but so eccentric exercises specifically, which is like so like for a bicep curl, the concentric would be the going up for a bicep curl and eccentric would be the lowering. So eccentric exercises are when the tendon is lengthening and the muscle, tendon and muscle are lengthening versus shortening, is best for tendon healing. So that's going to be good for this. And so also in this phase, there's all kinds of things. So you want to be resting, icing, and you can start to change your shoe wear as well. I'm not going to go into the specifics because if someone's watching this, they can kind of read it for their specific scenario, but it's not that exciting. So stage 2, same kind of thing. You're starting with these conservative treatment options. And so this is where the flat foot has now started, but it's not as severe yet. So potential for surgery depending on how it's going. But the immobilization, which, but corrective orthotics, but definitely this trying the conservative like exercises and things first. Okay. So really this is kind of the common theme, but you see in this picture, this is a more severe. So this would be a stage 4. So see how far these ankles are out and how flat this is here. So this person wasn't born this way. Over time, their feet got this way. So the more toes you can see out on the outside, kind of the more severe when they start to turn out like that.
It's first, sometimes you see people walking and their shoes like form that way. And it makes my ankles hurt looking at it.
Yeah, exactly. So yeah, that is a good point, that like one of the ways you can kind of assess where they are is you look at a shoe that they've been wearing a lot and see where the pressure is underneath. Is really helpful. And so these people are really wearing out this inside of their shoe. And so again, kind of back to those graphs, like this is not how the foot was designed to load. Foot was designed to load very strategically, and this is not how it was made to do it. Okay. So is a more exciting part. So these are different exercises. So again, catching at the beginning is really the most important part, but I think prevention is even more key, obviously. So I'm a physical therapist. So doing exercises for your foot intrinsic muscles, which again, kind of we talked about it in the one with the shoe wear, but is very, very important because these muscles are what also, so posterior tib is what's supporting this arch. And so it shouldn't be acting by itself. There's a bunch of little muscles that are supposed to be doing that as well. So all of these exercises really kind of focus in on getting support and backup for that. So toe pickups. So really this is picking up any kind of object from the ground with your toes. So you can do marbles, you can do coins, you can use a towel and like scrunch it, but getting those muscles to pick objects up with your feet. You could do dog toys and throw them. Molly would like that.
So you have to do like toe or foot specific exercises for that muscle. Like you can't, like there's no like I don't know, like calf presses or something like that.
Well, so this is things that are good for prevention. So the thing with the posterior tib, if it's already irritated, their eccentric exercises is what's going to be best.
Gotcha.
Which I don't actually think I put the specific on there, but so because it does the foot in motion, like it turns the foot in, you would want, in order to do it eccentrically, you would have a band or a weight pulling it out. You would go in and then slowly come out with it for tendon healing. And that would be the specific exercise for tendon healing. And so that would be, so it would go out and you would be slowly letting it come back in. That would be specific for that tendon. But if you kind of were listening to what I like, it's working, that muscle is working really hard already. So if it's already irritated, we do want to focus on tendon healing, but more so we want to try to take some stress off of it. So that's kind of more what these exercises are.
Gotcha.
I mean, walking barefoot is going to work the foot intrinsic muscles too, but this is more specific. And I have another slide on it too. But so picking these things up, this is stuff that's really going to help prevent kind of getting in a scenario where you can't, there's like no return. So arch strengthening caterpillar is you're laying on your back with your knees bent and your feet on the ground. And then you inch your toes back and then you walk your feet back like a caterpillar. So inch your toes back, walk your feet back.
Got it.
I tried to find a picture and there wasn't one, but. And then rolling like a lacrosse ball or a golf ball on the bottom of your foot. So this is really just trying to normalize the input from the foot to the brain. And then these ones, so this is from a research article, and essentially they looked at these 4 exercises, which is like toe yoga, which I've talked about before, and how much they get those foot muscles, the intrinsic muscles that are all throughout the bottom of the foot to turn on. And so it was very significant results for this. And so these are, again, the muscles that are going to take the stress off the one that we were talking about, that posterior tib. So in this figure A, you have your foot on the ground and you're trying to scrunch your arch up towards each other. So you're like squeezing, trying to make this part shorter, pulling it together. So in this one here, and then the next picture I have shows the muscle increase, but try to keep your big toe down and pull the other 4 toes up. Actually, that's this one, big toe down, 4 toes up. This one is you are spreading your toes out as far as you can and putting them down. And then this one, you keep 4 toes down, big toe up. So I like to have people kind of go between these two. So you put the 4 toes down, big toe up, big toe down, 4 toes up.
I think I did something like this at somebody's wedding.
Yeah, probably. You have finger toes, so you'd probably be good at it.
It was a joke about the dances that you do.
Oh. Whoops.
What dance is
The
that,
worm.
by the way?
Talking about the worm?
No.
Oh, put your right foot in, that thing?
Yeah, the
Hokey pokey.
Yeah.
Yes, hokey pokey. Yeah, it's pretty much what it is. So yeah, just need to be moving your toes around. So this is a very easy thing to do while you are, watching TV or something. For anyone that really needs the backup proof, this actually just shows those 4 exercises that we just looked at, how much muscle strength is increased percentile wise in each one of them. So all of these muscles on the bottom of the foot are just there waiting to be activated. In a normal day shoe, they are not getting that. So they need toe yoga or being barefoot more frequently to get them all functioning. And that will help prevent ending up a scenario where you have this posterior tib dysfunction. So that's what I got. So I know this was a little more complex of a topic, but other Tammy I thought wanted to hear it. So do you guys have any questions specifically?
I'm just curious when it goes back to being flat-footed. So some people are actually, the bone structure is a little flatter, or they just or have less muscle there.
It's kind of both. So some people are born with like anatomically their arch isn't as high. So like you see how this is kind of more curved. So some people, this curve is like some, let's see if I can make it more
The
significant.
curve is just a bunch of joints that are curving. It's not, I mean, this is stupid. It's not like a curved bone, correct?
No, it's a
Okay.
bunch of joints. Exactly. So these, yeah. And because it is a bunch of little joints, it's very highly changeable.
Yeah.
So some people, the structure, oh my gosh, Siri. Some people, the structure is a little bit more steep of a curve to begin with. Like my foot's a pretty high arch, and some people that curve is a little bit less high to begin with, but the foot isn't designed with absolutely no arch. That's not how the foot functions. So everyone, even the people that are born flat-footed, have an arch, but it's a little bit less high. But the less the muscles are turning on, the flatter that will get. So if someone was born flat-footed, but they really worked on like these intrinsic muscles, for example, it would look like they have a pretty significant arch in their foot. So it's something that you can change, but you have to be actively doing things. It doesn't just happen. So.
Got it.
Interesting, right? I know.
Yeah, it is.
Can you hear me?
What? Yeah, I can hear you.
You can hear me? I have a question. I don't know if you know that my daughter was in a car accident when she was 14. She had an L1 spine fracture that left her with some disabilities.
Mhm.
And they told her she has no plantar flexion, however you say that. And
Okay.
her toes are starting to curl. What does she have to look forward to? Like, I mean, her walk is all weird and
Okay.
her,
Does she not, can she can't like move her foot like that at all? Like down?
a little bit, but not much. Like she can't run or nothing like that.
Yeah.
If she runs, it's got to be on her heels.
Okay.
She has nothing for like her toes or
Like she
I don't
can't
know
move
how.
her toes at all?
Just a little bit, but they're starting to
Yeah.
really like
Yeah, so that's like
curve
a
under.
yeah, so what happens is, and Tammy, I'm more than willing to do like a FaceTime sometime with her and like have her show me where she is so I can make something more specific, give her some,
Yeah,
because I think so in that scenario, what happens is because the muscles aren't turning on as well, and I'd have to see exactly to know kind of like her specific presentation. But when the toes start to curl like that, it's really like it's a compensation mechanism. So it's because some other muscles aren't really turning on like they're supposed to. The toes are like gripping for dear life, essentially, to like create stability, to try to like grip the ground and like
yeah,
get some stability. So they start doing that, and that's when you can start to see that. Honestly, I realized my toes were doing that. It was a while like when I was having my foot problem myself, and part of it was I was always, because my feet hurt, I was always wearing flip-flops at home. I was never barefoot or I wasn't ever barefoot. So in flip-flops, you have to curl your toes so they don't fall off. So I was kind of perpetuating that too. So I don't know what kind of shoes she wears typically, but probably not flip-flops in the winter, but that's part of it. But I'd be more than happy to like do a FaceTime sometime. We can schedule to look and see. But honestly, these exercises would be really good for her. It would be really hard to do at first, but I would be really surprised if she couldn't use them. It would just be really challenging because probably has been longer since she has. And the more she could get them, because you can reverse the toe curl too. It just takes time to get
yeah.
those.
Because she lost feeling and sensation in like parts of her legs and her feet and all that. Like,
Okay.
she was at the beach one time and all her girlfriends were saying, you need to put your sandals on, this sand's hot, and she couldn't fit